Well, a lot of you are sending us questions that you have about COVID-19, and Rachel Lundberg sitting down with Dr. Anna Maria Temple to answer a couple of them now.
We actually talked 2 weeks ago today, which is crazy. What all have you learned about COVID-19 since then? The new information that people may have not heard about yet?
I don't feel that there's a whole lot of new information. I still think we know the information, but we're not really applying it, which is why we have to put into the Charlotte shutdown in effect, because we've heard about social isolation, but we don't feel it's applying to us because we're young, we're healthy. Therefore, we should have play dates, play tennis, and go to the park because we're outside and therefore it's not a problem. So the shutdown is coming because I think people are not getting the message. The other thing is that with the shutdown, it doesn't mean that then in 2 days the symptoms are going to go down, because if you've contracted the illness, let's say Saturday while you were at the park, and the shutdown happens this week, it may take you up to 14 days to develop symptoms. So you're like, oh, but I've been quarantined for 5 days. Why do I have symptoms? Remember, you can show symptoms for up to 14 days from the exposure, which is really important for people to know.
Right, that is really important. And you kind of mentioned the young, the healthy. Here in Charlotte, we've actually seen the number of cases reach a half when it comes to those middle-aged young adults, likewise in New York. So this virus doesn't seem to be targeting a specific age now. It doesn't mean that if you were to contract COVID-19, that it doesn't affect you differently if you're healthy versus if you're old or with the underlying health issue, but kind of speak to that generation that thinks they're invincible.
And that's the thing, and that's exactly who I'm seeing outside and who I'm seeing that they're not doing social distancing. The elderly folks and the people that are high risk are at home, they're barricaded, they're paranoid. And then I have the other people that if I take my dog down the street for a walk, I see people congregating, having play dates in the middle of the street, or as I said, at the park, they're playing volleyball, or they're at the dog park and letting their dogs play together and they're sitting chatting on a bench. I don't think they're understanding that they're also at a huge risk for themselves and also for spreading it to the people that are vulnerable. But just because you're 30 and you think you're healthy, because that's my other thing, how healthy are you really? Just because you're 30 and you're thin does not mean you're healthy on the inside. So you really need to be careful, because no one is sitting out there outlining what healthy really is and who really COVID-19 is really sparing.